What should you do after SIBO treatment? Should you follow a strict SIBO diet or take any particular supplements? In this episode of the Inside Knowledge podcast, I'll be sharing my thoughts on what steps can be really helpful after you've worked on treating your small intestine bacterial overgrowth, even if you can't afford to run another test. Many of my clients have been given antibiotics by their doctor, but then no advice on lifestyle or diet, and they just struggle to know what to do next. So this week, I want to explain more about how I work with clients after a SIBO treatment to maximise any gains you've got from your kill phase and take a longer approach to nutrition. Welcome to episode 94 of the Inside Knowledge podcast for people with IBS. I'm Anna Mapson. Today's episode is all about what to do after your treatment of SIBO. So I'm going to assume for the purposes of this week that you already know about small intestine bacterial overgrowth. And if you don't know what I'm talking about, before you listen to this episode, I would say go back, listen to episode 11, which is all about what is SIBO, episode 12 on how to treat it, episode 31 about supplements for SIBO, and episode 40 about diets for SIBO. Those 4 episodes are really key in setting the foundations for this conversation. So I'm going to assume for today that you are already a seasoned listener, you understand what I'm talking about, and you know loads about SIBO already. So go back and listen to those if that doesn't apply to you. Let's just get into the details of today's episode. If you've had treatment for SIBO, I'm going to assume that you've had a test in the past that says you definitely have either SIBO or you have intestinal methanogen overgrowth. The good thing about having the test is you will know on the breath test what your parts per million numbers were. So you get that test out and have a look at the test results. There are 2 things that you're looking for during your treatment for SIBO. You're looking for a reduction in the parts per million of the gas on the breath test, and you're looking for a reduction in your symptoms that have been bothering you. The treatments for SIBO are generally thought to reduce the gas levels by about 25 or 30 parts per million per treatment round. So if your gas levels were at 150 hydrogen perhaps, and I have seen very high levels like that, or very high levels for methane might be somewhere like 70, 80. You're not going to resolve your SIBO in one treatment round, and that is something that's really important to get your head round. Taking one course of rifaximin will not resolve your SIBO unless you actually had quite a mild case in the first place. And this is because we can't expect to have a massive drop in gas parts per million, which means that you've reduced the microbes that are making that gas. You don't get that in one treatment round, and that's something that people don't really always understand up front. But in an ideal world, what you would do is once you've finished your treatment, within a few weeks of finishing the treatment, you'd run another test, and that would look for a reduction in the gas. Alongside that, you'd also look at whether your symptoms have got better. So maybe you have a bit less bloating, maybe your diarrhea has reduced to just 1 or 2 times a day. These are the things that are really important to look at alongside the treatment, because what we want to know is whether this treatment was effective for you. Now, whether a treatment works for different types of microbes is somewhat of a guessing game. Even with medication that doctors will prescribe you, so whether you're having a drug like rifaximin, metronidazole, ciprofloxacin, any of those particular antibiotics, all effective and used regularly for treating overgrowth in the small intestine, but not all the bugs that produce the gases of hydrogen, methane or hydrogen sulfide will all respond to the same drugs or the same herbal antimicrobial treatments. So some bugs will work better with oregano attacking them, some better with allicin. Now, the problem is with the herbal antimicrobials is we don't really have the evidence that says this is exactly how much you should take. These are the particular bugs that work best. There just really isn't the evidence base, to be completely honest with you. But clinically, we know that it does work. It does. So, for example, allicin is very effective at reducing methane-producing microbes in my clinical experience and in all the other SIBO practitioners that I am linked up with. But assuming you got lucky, maybe you've had a reduction in your gas parts per million, you can see that that treatment is working, but you still have some symptoms then there's no harm in doing another treatment round with the same protocol that you used before. The problem is with taking multiple rounds of antibiotics, especially if they are systemic antibiotics, such as metronidazole, then these can have a negative effect on your large intestine gut bacteria. So you may not be comfortable with that depending on the rest of your health. And that's why doctors are the only people who should be prescribing antibiotics. Sometimes people will see a reduction in their gas levels, but not a reduction in their symptoms. So the test is showing that the gas levels have gone down, but they don't actually feel any better. And this can happen because either their symptoms are not driven by SIBO, and this is a possibility, or it's just that they're coming down, but they haven't quite got to the level that will affect symptoms. So in those cases, sometimes another round of treatment is warranted. The other way round is that you can feel better, but the gas levels are still higher. If you're feeling better, but the gas levels are still high, or you haven't tested yet and you don't really know whether to do another test or not, then what you could do is just take a little pause from all the treatment, and I'm going to talk about some of the things you can do during this pause time. The cost of retesting for SIBO is quite high, and it can be around £150 or more to test. So doing multiple tests is not normally doable for most people that I work with. There is a little device where you can measure your breath called the Food Marble. I'm not sponsored by them or anything, this is not an ad, just saying that it's something you can get at home and you can measure your gas levels. So that is another approach to do your own home test. Now, I don't think they are as reliable as a proper breath test that you get from a lab, but it's an indication and can give you an indication of the trend of your gas levels. So something to investigate anyway. You may also then be able to run multiple tests, and it shows you whether your treatment is working, whether your diet is suiting you, and can be a good option for lots of people. If you don't feel any better at all, and actually some people maybe even feel worse during their treatment because antibiotics can also disrupt your digestion and make you feel a little bit poorly. Some people feel worse during their treatment, but assuming you finish the treatment, your symptoms are still there. It hasn't really dented how you're feeling. One of the things you could do would be to try an alternative treatment. If you've done this by yourself, you're using supplements, you could try a different combination, a different approach to killing off the microbes. If your doctor has prescribed you treatment, then again, go back to them and ask for a different sort of antibiotic, a different way of treating the microbes. During the gap after a treatment, you may want to take a little break anyway. Even if you do decide to go through another round of treatment, whatever that is, you might want to take a little pause. Just let yourself resettle, see how your symptoms are, what happens in the next 1 or 2 weeks. During this time, I suggest eating as broad a diet as you can tolerate. There's no reason why you should be staying on the low FODMAP diet or going on a special SIBO diet. And the reason is because SIBO isn't necessarily led by food that you're eating. You certainly can get reactions to food. You can get symptoms from eating certain foods, but it is not going to drive the growth of SIBO. It's not going to increase the amount of microbes. Because treatment of SIBO can be multiple rounds, it can take months and months. For you to stay on a really restricted SIBO diet for 9 months, say, is not good for your health. It means you're missing out on lots of key nutrients, including not only, but many things that people who have IBS and SIBO are low in, include iron, calcium, zinc, B vitamins, vitamin D. Some of those may be down to malabsorption, but more often than not, they're down to dietary restriction. And I really push for people trying to get back to eating as broad a diet as you can tolerate. Now, what that might mean is, say we take the example of lactose in dairy. Now, we know that when people have SIBO, sometimes their digestive enzyme function can be reduced. You might struggle to produce some of the enzymes that mean you break some sugars down. So things like lactose need to be broken down into smaller component parts for us to better absorb them. If they're not broken down, then they travel to the large intestine and can cause diarrhea, gas, bloating. We don't want to have those symptoms back, sure, but what we do want to do is to try and eat the most amount of these trigger foods as you can tolerate. For example, with dairy, even people who are lactose intolerant can normally manage small amounts of dairy per meal. So something like 60 millilitres is a very small amount. Like it might be the amount you might have in your tea, and you're probably okay with that. For example, cheese has got hardly any lactose in it, especially if we're talking about hard cheeses like cheddar, parmesan. These cheeses can be enjoyed and brought into your diet to give you variety and flavour if you can tolerate them. Tolerating a food might look like a small bit of bloating or a little bit of gas, but not to the extent where you are laid up on the sofa, with a hot water bottle feeling really awful or dashing to the toilet. Like, that's not tolerating a food. However, if you can get away with, just a little bit of bloating, or I felt a bit sensitive, or my stools were a little bit loose, that probably is tolerating a certain food. And so it would be good to bring these back into your diet. Just to reiterate, there is no need for you to stay on a SIBO diet either during your treatment or after your treatment. I've also worked with someone just recently who said she was told by her doctor that she had to eat very high FODMAP foods during the treatment with rifaximin. She was trying to eat lots of bread, lots of lentils, cauliflower, all of these foods, because she was trying to go super high FODMAP to try and get in as much fibre as possible. Now, the theory behind that is that you activate the bugs when they are trying to reproduce and eat the fibre and they're having a happy time, and then the antibiotics come in and kill them. And the purpose of eating the higher fibre diet is to stimulate this activity that then the antibiotics are more effective. Again, we don't really have very much evidence that that is a good option. So I go back to my phrase, like, whatever you can tolerate. I do think in that situation, she could have had a higher fibre diet. However, some of those foods, particularly things like lentils and chickpeas, are just really well known to cause a lot of gas, even in people who don't have a sensitive digestion. So the thought of having to eat high FODMAP for 2 weeks was really putting that person off treating their SIBO. One of the things that's really important after treatment of SIBO is to keep your digestion flowing and moving. And even if you're someone who has diarrhea and very loose stools and you think, oh my God, food already moves through me super quick, I do not need to speed my gut transit time up anymore. There is a difference between the motility in the small intestine and the large intestine. And so sometimes you can have slow motility in the small intestine, and that is the migrating motor complex, this small migrating wave of electronic pulses and small movements that cleans up the small intestine. That process can be damaged, and it might be down to an infection that you had previously, like a stomach bug, diarrhea and vomiting type thing. Could be down to a whole range of reasons. Medication you've taken. That migrating motor complex can be damaged, and it can be slow even if you have diarrhea. And also another key thing is your eating pattern. So whilst I'm talking about keeping your digestion flowing, one of the things you need to try and work on is having 3 meals a day, ideally. Now that might look like, for you, maybe it's like 4 or 5 smaller meals if, for example, you have very bad reflux or you have problem with slow stomach emptying. You might need to have smaller meals at more frequent intervals in order to try and get your good nutrition in. One of the things you want to do is eat regularly. Ideally, eat to a bit of a schedule, but you do not need to be stuck to the clock. If you're someone who normally has their lunch at 12:30, then eating your lunch at 1:30 is not going to make very much difference. The erratic eating pattern that I do often see, though, is some days you have breakfast, some days you won't. Some days you will have breakfast, but then you'll skip lunch and then you'll just have dinner. Some days you have dinner at 5 and you don't eat again till 8 the next morning. Some days you're eating dinner at 9 o'clock at night. Just very erratic eating patterns all over the place. And this can be a real challenge if you have shift work and you're actually not in control of your time available to eat, but that's another story. But for most people who do have control over their eating pattern, I would suggest trying to get in regular meal times and trying to keep your digestion flowing. We want to not be grazing all day, but having 4 small meals or 5 small meals, if that's what you need, is also okay, because you need to just get that nutrition in. You can't just say, I'm only going to have 2 meals a day because I want my migrating motor complex to work. It's not going to work if you're underfueling, you're not eating enough food. There are some supplements or medication even that can help with the migrating motor complex that we call prokinetics. So they're like beneficial for movement. The kinetic is movement. They're helping that movement of the digestive tract. Things that you might consider as a supplement would include ginger, artichoke, 5-HTP. These all have a positive impact on the motility of the digestive system. They are not laxatives, so they won't necessarily increase your transit time, but they could help with the self-cleaning process. Ginger is pretty good. I like a lot. It's anti-inflammatory and has been shown to help with feelings of nausea, help with stomach emptying, to try and get that process going. So for someone who feels like they get full very quickly, someone who feels they can't empty their stomach, then ginger capsules are fantastic for that. These are obviously not recommendations for you. You need to go and check what's suitable for you and your body, your health conditions. So I wouldn't recommend it for everyone, but ginger can be a good option. The other thing is 5-HTP. Now this is definitely not good for you if you're taking any kind of antidepressants. You shouldn't be taking anything, because 5-HTP is a precursor to serotonin and may impact on your medication, but that can be helpful for some people. And artichoke is the other one I just mentioned. That also encourages bile flow. So go and listen to episode 91 I did about bile, because artichoke in there gets the bile flowing. Now, for some people that's really good. Other people it might be too much. And so you might find taking artichoke as a prokinetic actually has a different consequence and changes your digestion. In terms of the food, as broad as you can, as much as you can tolerate, eat regularly. In terms of prokinetics or things to get going with, ginger, artichokes, 5-HTP. Then the other really important part of your life after SIBO treatment is mindfulness, or like your food relationship. So where you've had a lot of fear about food, working on getting a better relationship with the food and with your diet is almost as important as some of the food reintroductions, because so understandably you've had a terrible time of it. You've realised some foods were kicking off your symptoms. You've brought them out of your diet. Now you're going to bring them back in again. But of course, there's a whole level of fear about that. How to do the reintroduction is really important and really can be very triggering. Listen to episode 43 where I talked about ARFID, and that is avoidant restrictive food intake disorder. Now obviously that is a proper eating disorder. Most people I work with are just edging towards that in some ways, in terms of a massive fear of the digestive consequences of food. So it's something that I work on a lot with my clients, really encouraging you how to reintroduce foods in such a way that you feel more comfortable. Often people will ask me, do I need to take probiotics because I've taken antibiotics? Is there a need for it? And I don't think there is. I know that might be a bit controversial, and that we think whenever we've killed off microbes we need to reintroduce them, but it's not always essential, particularly if you have a very good diet with lots of variety and lots of fibre in it. Now sometimes probiotics in SIBO can actually be helpful, particularly when we're talking about strains that are well known to help with gut motility. So there are a couple of strains of bifidobacterium that have been well tested to help with more frequent stools, softer stools, like easier to pass, as well as multiple poos per week. So if that's something you want to work on, then again, potentially probiotics could be an option for you as an add-on. Some people worry though that taking probiotics with SIBO, you're maybe adding to the bacterial load in the gut, and that is certainly another consideration. So some people with methane predominant SIBO, the ones who'd been taking probiotics had a higher load of the microbes that were creating methane. So it's not always a good idea to take probiotics, and I don't think you necessarily need to do it after a treatment round. What you should focus on more is increasing your diet variety, increasing the prebiotics naturally through food, which are commonly in all of those higher FODMAP foods that you've probably been avoiding. Maybe you've listened to all of this and felt a bit frustrated that I haven't really given you an exact protocol, and I can understand the frustration. A lot of people I work with say, I've just listened to all the podcasts and read all the blogs, but I still can't work out what to do. And that is really because there isn't one pathway that I can tell you. And I wish I could. I wish I could say, follow these exact steps and you will reduce your SIBO, because it just doesn't work like that. And I really understand your frustration if that's how you're feeling. The things that I would ask you to consider would be retesting, so checking your levels. Have the gas levels gone down? Taking that into context with your symptoms as well. Then if you have seen progress, you can repeat the round to try and get the gas levels down again. If you haven't seen progress, try another type of treatment for SIBO. Maybe if you tried antibiotics, try the supplements instead. Maybe the other way around. If you wanted to go down a natural route, actually maybe the antibiotics is what you need. So those would be the options straight after the test. In terms of food, try to keep on introducing foods. Try to keep the level of fibre as high as you can tolerate, and also the level of variety as high as you can tolerate. Then also work on your gut-brain connection. Do as much as you can to reduce anxiety, good exercise, good looking after your body as a whole, not just focusing on your gut, really thinking about the body that your gut lives in and trying to nourish it. And I mean nourish it through nutrients, of course, but also things that bring you joy, things that you love doing, trying to get outside, fresh air. These also really help to keep your body as strong and resilient, and that will help with your digestive health. And then also in terms of supplements, consider whether a prokinetic is helpful for you, and consider whether a probiotic is going to be helpful for you. I hope you've got something out of this episode that you can take away and try, or something to think about. If you want help from me to work through this in a 3-month program where we can really get to the bottom of your issues, unique situation and lifestyle, then please get in touch, book a discovery call with me so we can work through what you're looking for help with, what you've already tried, what's worked, what hasn't worked, and I can tell you whether I think we're a good fit together, and you can ask me anything you like about working with me. Thanks for listening to this episode of the Inside Knowledge podcast. Better digestion for everyone.